Thank you very much, Sarah. Good evening, good afternoon, and good morning to everyone. Welcome, and thank you for joining us for today's session. We generally have these meetings with the Advocacy and Accountability Working Group, but because this topic is so deep and intersectional, we saw the necessity to broaden the inclusion of other parts of the RHSC community, including the System Strengthening Working Group, the regional FOROLAC group, and inspired primarily by our climate policy and intersection group within the work with AAWG. We are joined today by our colleagues who are going to walk us through a little bit of the conversation around climate action and the intersection on rights-based approach to reproductive health. Both colleagues are part of the Margaret Pyke Trust, and they'll be walking us through a fairly interesting conversation, and then after which we'll be having a Q&A session and discussion, hopefully more around how we will develop talking points and key advocacy messages around the information that was being shared today. So with that, I'm going to introduce Carina Hirsch and David Johnson from the Margaret Pyke Trust. I'll hand it over to you, Carina.
Thank you so much. And thank you so much to the Reproductive Health Supplies Coalition for having David and I on your webinar today. And it's exciting that it's both the Advocacy and Accountability Group as well as the System Strengthening Working Group, because of course these issues linking human and environmental health and reproductive health in particular is so very important as we look to advocate beyond the sectors, the traditional allies, and the people. We know we need to be making new allies. We need to be finding new arguments in new sources of funding to make sure that we really address the needs of women and girls as they're increasingly affected by biodiversity challenges and the very harrowing effects of climate change that we can see, especially in low middle income countries. And we know that women and girls who are vulnerable in rural and marginalized communities are those suffering the most. So I might just ask my colleague, David Johnson, the Chief Executive of the Margaret Pyke Trust, who's here with me today. He's kindly sharing our slide deck, and I will kick off our presentation. Yes, so yeah, really delighted. We're David, as I said, Chief Executive. I'm the Head of Advocacy and Policy at the Margaret Pyke Trust. David and I have been working together on this very particular topic for the better part of the past 10 years. So we feel we've come a long way. We've got a long way to go, but this is such a very important piece of work, and you can see it's really taking shape, and it's really gaining traction in global policy discussions. There was a group of health leaders that wrote an open letter, I think, to Fortune 500 leaders. It was just published yesterday on the importance of considering health in climate response, in particular in adaptation and resilience. So they're constant reminders of why this is so important. So I think building understanding and knowledge is really, we're really delighted to be able to do that for this group today. But in particular today, we're focusing on a piece of work that David and I championed, which is about integrating reproductive choice into conservation policy, and in particular international biodiversity strategies and action plans. So why are we championing this work? What makes us good advocates and well positioned to be doing this? So the Margaret Pyke Trust has a very long-standing history in sexual and reproductive health and rights. And like I said, for the better part of the past 20 years, actually, Margaret Pyke Trust has been looking at focusing on advancing family planning and reproductive health in the areas of the world with the greatest, highest levels of unmet need. And what we found, and what others are increasingly coming on board with, is that these areas of greatest unmet need, where we really see a lack of healthcare services, and where healthcare services are even present, they're of very poor quality. So these areas very often overlap with areas of great biodiversity conservation significance and areas that are experiencing complex biodiversity challenges and increasingly the effects of climate change. So we really see this coming together, this perfect storm of interconnected challenges that require an equally interconnected response. So that's why the Margaret Pyke Trust, we joined the International Union for Conservation of Nature 6 years ago. And what we say is we're the only member of the IUCN, the International Union for Conservation of Nature, to also have 50 years of expertise in reproductive health. Now, because we aren't speaking to a biodiversity or a climate audience per se today, the IUCN, it's the largest global authority on the environment and on measures to safeguard the environment. It brings together over 1,400 member organizations. And what's very interesting and actually particular about the IUCN is that it brings together 3 types of constituencies: member governments, Indigenous peoples organizations, and civil society organizations. So as I go into more detail on what we've done, for example, passing a resolution, you see that that's quite a feat, because to pass a resolution means you have to get all 3 constituencies on board. So since we became a member of the IUCN, a very active member of the IUCN, small but mighty, an active member of the IUCN, we've been steadily building an alliance across sectors. Can I have the next slide, please, David? Thank you so much. So if we really want to affect change and be experts and know what we are talking about in the biodiversity sector, we have to affect change from the inside. And that's why we said we've got steady footing in the SRHR sector. The Margaret Pyke Trust was founded in 1969. We need to start making a really strong track record within the biodiversity and climate sector. So we joined the IUCN. We were able to start building an alliance across sectors and constituencies. So by across sectors, I mean across the health, livelihoods, biodiversity conservation, and climate sectors, and across constituencies. So that means we started speaking, and this was during COVID, so it was very interesting. We started speaking to governments from around the world, both in low and middle income countries, but also donor countries, to really start building a groundswell explaining these arguments of why reproductive health and biodiversity conservation and climate change, why they are connected, and why it's a win-win for human and environmental health if we address them in a comprehensive way rather than in silos. In addition to that, we became observers of the United Nations Framework Convention on Climate Change. So the UN treaty and effectively the UN agency that addresses climate change. That means, yes, being part of attending climate COP conferences, but also in between the COPs, we are active. We are working with partners to really try and address these issues from a gender lens, from a health and a human rights lens, but also bringing that environmental conservation knowledge and those partnerships. We also used our position within the IUCN to pass an IUCN resolution. And this means that 4 years ago, at the most recent World Conservation Congress, which are those moments of gathering of the IUCN, we brought together a broad base of support, and we were able to pass a resolution. And that means that the IUCN has recognized that removing barriers to rights-based and voluntary family planning is an environmental conservation issue. That if we're going to have effective and really impactful conservation efforts, you must address and take into consideration the health and livelihoods needs of local communities. So that was a very important moment within the IUCN. And passing that resolution has really been a vehicle for us to continue to affect change. And David is going to go into some of those examples of additional conservation policies, whether it's for species, ecosystems, or at the global level, that we've been able to affect because we have this initial vehicle for affecting change. And the passing of the IUCN resolution also allowed us to establish the IUCN Biodiversity and Family Planning Task Force. And again, that task force, David and I co-chair it, and it really brings together experts from the SRHR sector. So we've got representatives from the large global health NGOs, as well as biodiversity and climate professionals. So those are just some of the examples of how we are working at the intersection at the policy level. Now, but you don't just have to take our word for it that these issues are connected. There are some, and we're just spotlighting a couple of the references that we are seeing, prominent references in authoritative sources in global climate and conservation policy, where we see how is reproductive choice being integrated into these policy documents. So first I'll highlight the Intergovernmental Panel on Climate Change. So here you see climate change on your right-hand side, climate change 2022, impacts, adaptation, and vulnerability. Every 3 years, the Intergovernmental Panel on Climate Change, or the IPCC, which is the scientific body that advises the United Nations Framework Convention on Climate Change, on how it should address climate change, what it should do, and what are all the issues they need to be considering. So in their two most recent reports, which are called the fifth and the sixth assessment reports, it has been noted, first of all, in the fifth assessment report, the eligibility of voluntary rights-based family planning as part of climate adaptation was referenced. Fortunately, this hasn't really translated into many governments taking it up at a national level, though there are a few examples, and we can go into those in the discussion, and that's very interesting. But on a broad scale, globally, it hasn't translated into funding, for example, towards reproductive health. The more recent sixth assessment report actually includes numerous references to various aspects of sexual and reproductive health as part of adaptation and resilience. For example, it highlights child and maternal health resulting from access to family planning as an important part of climate resilient development. So actually, improved maternal and child health, thanks to improved access to voluntary rights-based family planning, is a pathway to climate resilient development. And I think that's very important, especially with those of you with the system strengthening lens. These are important arguments. And the IPCC report really provides an important entry point for the inclusion of reproductive health as part of multi-sectoral, right? Because we hear lots of calls for multi-sectoral, gender-sensitive or gender-transformative approaches, and then it doesn't go any further. Documents or calls for these kinds of approaches don't go any further what they look like. So really one of the aims of what we're doing here today is showing you, and hopefully we're successful in that, in explaining what this looks like in terms of integrating it in policy, but also in terms of programmatic approach, and I'll get to that. And a second example that I'd like to call out to you is UNEP, so United Nations Environmental Program. So two of their very high-profile global reports, they've identified a suite of actions that will further gender equality, women's empowerment, economic development, and biodiversity conservation. So the publication we've called out is UNEP 6, Global Environmental Outlook, which was published in 2019. It calls for greater access to family planning programs to address inequality, along with education and employment opportunities. And a slightly more recent report published in 2021 that is called Making Peace with Nature. It actually echoes these arguments. And environmental ministries who are revising the National Biodiversity Strategies and Action Plans that David will go into more detail about, they might not be aware of the extent to which family planning has actually been recognized by the United Nations Environmental Program and other agencies. So these are just a couple of examples of references in global climate and conservation policy that we can use when we go to make those arguments nationally. Next slide, please, David. So I want to just quickly pivot. So we've looked a little bit at policy, but like I said, what's important to highlight is what does this look like at a programmatic level? Because those who are updating national biodiversity strategies and action plans, they'll not only want to ensure that that their national strategies reflect biodiversity goals and biodiversity targets, but also the SDGs. And I think this is where we can come together and link it back to what people on this call know best. So there's called Population Health and Environment Programs. So leaving the name aside, I want to explain to you what this type of integrated cross-sectoral program looks like. And why it's important for our discussion today. And you'll see the various SDGs that this type of programming advances. So population health and environment programs, first of all, they're a multi-sectoral partnership approach to biodiversity conservation, to human health, and to sustainable livelihoods. Now, these programmatic approaches, they're very unique. They're developed, first of all, they target, like I said, these last mile rural communities. This is where this type of program is relevant. We aren't saying that this is a one size fits all, or this is a blanket approach to achieving the SDGs, but it's certainly a very relevant and very impactful way of achieving these various SDGs in these last mile communities where we don't want to leave anyone behind. So these programmatic approaches, they're developed inclusively and equitably in response to local situations and the express needs of the people most closely linked to conservation. And as I said before, people most closely linked to conservation are those people who rely directly on natural resources for their lives and their livelihoods. And at the same time, these are the populations that are so affected because they have a complete lack of healthcare or almost complete lack of healthcare, or at least quality healthcare in the areas where they live. So this type of approach is intended to improve human health, in particular reproductive health, while empowering local communities to achieve sustainable livelihoods, manage their natural resources better, conserve biodiversity, and maintain ecosystem services. Now, this type of programmatic approach has been in place for a long time. USAID was one of the first donor champions to promote and to champion this approach. And what often comes out of the programmatic, the monitoring evaluation, and us as the Margaret Pyke Trust, together with the International Crane Foundation and Rugurama Hospital in Southwest Uganda, have also been implementing such a program for over 3 years now. And what comes out of the process evaluations and impact evaluations is that there's a real value added of PHE, of this type of programming. By integrating across sectors, you get an impact that's 1 + 1 = 3 rather than 1 + 1 = 2, because you're able to leverage parts of the population that you wouldn't be able to have contact with or to leverage if you were doing a single sector program. And you've got a real positive and a real community goodwill and other sorts of positive effects that mean that by working across sectors, bringing actors together, even project implementers from different sectors together, you are able to have an impact on all of these different development sectors that you wouldn't have. So that's the importance of integrating reproductive choice into biodiversity conservation, into climate action, and also increasingly sustainable livelihoods. So happy to talk more about that, but I think I'll turn it over to David now, who will tell you more about the biodiversity side of things. Thank you. Over to you, David.
Thank you, Carina, and thank you to the Reproductive Health Suppliers Coalition for giving us this opportunity. So Carina has kicked us off and spoken a little bit about the Margaret Pyke Trust, a little bit about existing policies where we can see that some organizations, including UN agencies, have recognized that it is okay to work across sectors and it is relevant. But after that background, what we really wanted to talk about is a specific opportunity for some national advocacy where we're looking for allies to work with us who might be able to achieve a meaningful change in your different countries. So before I go into how we'd like to go about talking about that, I'd like to talk about one particular convention, and that's the Convention on Biological Diversity. So back in 1992 at the Rio Earth Summit, there were 3 of the Rio conventions that were created. It's very common for us to hear about the UN Framework Convention on Climate Change. That's the most well-known. That's the one that gets in the news a lot that we would speak about. And we're seeing progressively more and more SRHR organizations engaging in climate discussions and going to COP. But there are also 2 other conventions which are also important. One of them is a convention about combating desertification. That's not the focus of today. The 3rd convention is the Convention on Biological Diversity. So there are 3 focal areas of this convention. That's the conservation of biodiversity, the sustainable use of the components of biodiversity, and the fair and equitable sharing of the benefits that come from biodiversity. And perhaps if we take a moment to consider that this is a convention dating back over 30 years, it might be surprising that a biodiversity-focused convention, even from that long ago, of its 3 focal areas, one of them was about equity and the fair use of biodiversity. So it wasn't fortress conservation. Now, as a treaty, there are 196 different countries which are parties to the Convention on Biological Diversity. And it's also possible, like it is at the UN Framework Convention on Climate Change, for organizations, for NGOs and others to gain observer status. Now, very recently, this year, the Margaret Pyke Trust gained observer status of the Convention on Biological Diversity. We're not sure because they don't publish a full list of observers, but we will be one of the very few health NGOs with observer status, or perhaps the only one. We're not sure. Now, just like in when everyone talks about climate change and climate COP a lot, COP actually just stands for the Convention of Parties. So really, it's actually about the gathering, the annual gathering of the state parties that have signed a treaty. So actually, COP should really be described as climate COP or biodiversity COP. Most of the time in the news, people use COP as shorthand for the climate gathering. But actually, next month will be the COP of the Convention on Biological Diversity. And I'm hoping that one of our colleagues, I haven't gone down the attendees from Colombia, Nicolas Giraldo, is present on this call because he's at Pro Familia, and he will be attending the next Biodiversity COP on the Margaret Pyke Trust's accreditation. So as a treaty with 196 national or state parties, it's a requirement under that treaty that each country comes up with a national biodiversity strategy and action plan. So that's the second bullet point on this slide. Sometimes we'll refer to them as national biodiversity plans or NBSAPs, but all it is that every country that's a party to CBD should have an NBSAP. And the purpose of that national plan is that each country needs to consider how it will itself further the aims of the Convention on Biological Diversity within its borders. So we're all very familiar with health plans or national development plans, and the NBSAPs are just the national plans about biological diversity. So as you would expect, these are led by the ministries of environment in each country or a related environmental agency. But the point is, these are exclusively national plans just within a global framework. So the contents of each country's plan does come from the Ministry of Environment. But the very interesting thing that's really the purpose of this call and the publication which we're about to turn to is because the countries of the world that are parties to the Convention on Biological Diversity are about to update or are updating their national plans. So just like you will all be familiar with the Millennium Development Goals being replaced by the Sustainable Development Goals, there are also global goals under this convention. So the old goals have just been replaced. At the end of 2022, the Global Biodiversity Framework was launched. That's what this image shows. And that is a set of 23 targets, which the world has committed to by 2030, as well as 4 goals to reach by 2050. So the requirement now is that every country, no matter how many different NBSAPs they've published since they became since they became parties to the Convention on Biological Diversity, now means they have to update their national plans to reflect the fact that we now have this new Global Biodiversity Framework and new goals. A further surprising thing for a biological diversity convention is that now with this new Global Biodiversity Framework, there are multiple references to gender. And the line that I would call out most that's relevant for everyone on this call is that the Global Biodiversity Framework acknowledges the interlinkages between biodiversity and human health. In other words, it reflects lots of the things that Carina was talking about moments ago. So this is our publication, Reproductive Choice in National Biodiversity Policy. And we're hoping that today, by talking to all of you, we might be able to find another couple of allies in another couple of countries that can work with us. And we were very happy to work with you at a significant level to try and change national plans. What we've done in the publication, and we'll share the link again in the chat and perhaps after this call, is that we've covered a lot of the ground we've already spoken about today. We've set out what is the Convention on Biological Diversity. what are NBSAPs. We've introduced the fact that there's this new set of... Oh, I was hearing myself then. That's quite unpleasant. That there's these new set of goals that we're working towards. But then really importantly, we've come up with 10 arguments which we think are applicable in most countries or in many countries to how you can engage your national governments to change your national plans. Now, the Convention on Biological Diversity has or ensures that each state party has a focal point, and they publicize this. So within our guide on page 4, we provide the link to the section of the CBD website of how you can find out who your national focal point is. So that person in each of your countries will almost certainly be in the Ministry of Environment, the Department of Environment, or Climate Change or something, or one of the related agencies. But that person's task is being your government's focal point with people like us about the NBSAP process. So even though the overwhelming majority of people on this call will probably not know or have connections in your ministries of environment, of course, your connections will be with ministries of health. We're able to find out who is the contact point in your country that will be leading your government's process of updating your national plan. Our hope is that we can find, even if it's just 1, 2, or 3 NGOs in multiple countries that can work together and collaborate on your NBSAPs. So we're hoping that you can firstly consider your potential partners. There will be other organizations you work with in your countries that have advocacy teams. Maybe you're already working with people in rural development or in livelihoods. It's probably less likely that you will be engaging with environmental NGOs, but maybe even in your own networks, you are doing so. So our hope is that as a start point, we can try to build mini alliances in different countries of potential partners that can work together. Once we've done that, we would encourage you to consider which one of you is the most appropriate to contact the CBD focal point in your country. We're doing this process now we've contacted 20 different governments, and we found that a lot of the time we do know people in country that actually have a personal connection with the relevant member of the Ministry of Environment, which has obviously ticked things off in a very positive way. Thirdly, once we have engaged the right person in your government, we merely want to find out what the process is. Now, there is not a rule with the Convention on Biological Diversity on how each country must come up with their plan, but it's going to be pretty similar to all of the health consultation processes you've been in. We've had particular strides with Madagascar, but we're involved, as I say, in like 20 different countries. And most of the countries we've engaged with, we merely need to register to be on the consultation process. We've had a couple where you needed to be registered in the country. So we have found, for instance, Rwanda. So we found a Rwandan partner to work with us on that. But it's all about just finding out when will the process start in your country, because some countries are seeking funding so they can actually properly resource this process, and therefore they haven't started. Others have already started, but we're not aware of countries actually finishing this process. So these national plans will be between 100 and like 300 or 400 pages long. So it will be a long consultation process. But once you found out about the process in your particular country, then it's just about making the case. And that's what we'll go into in a moment based on what we've put in our guidance. And then hopefully with calls like this, we're hoping that different actors involved at the national level will feed back to us and give us further ideas, what arguments have worked in your country. So you can in time obviously go through our guide. We've tried to make it very accessible and simplistic to follow. But there's a lot of entry points that you already know about. Because one of the things that we recognize in our work is that whether it's a government department or an NGO, most of us work in silos. So ministries of health do not probably even know that ministries of environment are going through a consultation process on their NBSAP. Because frankly, why would they? Because we're so used to focusing on what we know best. But you as advocates in your different countries will know, for instance, the content, of your national development plans. Now, very many national development plans will include references to population dynamics, to references about the demographic dividend, as an example. But what we have found in our organization's analysis is some work that Carina undertook a couple of years ago, back when FP 2020 was around, rather than FP 2030. Carina analyzed all of the NBSAPs that had been published at that time in the FP 2030 focus countries. I can't remember the precise figures now off the top of my head, but it was something like 64 of the 69 countries all highlighted that population dynamics was a big threat to biodiversity in their country. But none of them went on to say, and we have national plans or national health plans that highlight that we need to focus on SRHR. None of them went on to highlight that they had FP 2030 commitments to make sure that last mile communities were served. So there were, it's the challenge that when departments don't speak to each other, they don't necessarily know that there is already policy support for what we're asking for. You, of course, will know what's in your national development plans. And I suspect in very many cases, there will be things in your national development plans that are directly relevant to your country's NBSAPs. And it's exactly the same with your national health plans and your national family planning plans, if you have them, and your FP 2030 commitments. But this is why, for us, it's really important that we only undertake this advocacy with national experts like you. We understand something about the Convention on Biological Diversity and the general points about the connections between environmental and human health. But we don't have your expertise on the national knowledge, and that is obviously fundamental. But then the image here that I have shared is from a very recent policy that we've had some engagement with, along with many others, and that's the recently published Health National Adaptation Plan from Uganda. And just to call out something from that climate policy, they have actually in this policy stated that it is important to develop, test, and scale up projects and innovations that integrate climate change, gender, family planning, sexual and reproductive health, and nutrition in health programs at different levels. So in other words, they have called out in this what is fundamentally a climate plan, although it's obviously the specialized health plan within the climate and UNFCCC process, the need for us to develop the kinds of projects that Carina was talking about, where the health and environment sectors can work together. So I think we do have people on the call from Uganda. They, of course, usefully have a Ugandan national plan, this health map, that's relevant to changing the Ugandan NBSAP. But then there are other suggested entry points which are less likely to be known amongst the people on this call, because this is the other side of our work. Carina highlighted that when we embarked on this work at the Margaret Pyke Trust, we wanted to be seen as an insider in climate and biodiversity spaces, calling for reproductive choice and SRHR and gender changes, rather than being on the outside telling other people what they should do. So we became incredibly active in every policy process we could possibly engage with at IUCN. So they started to see sexual and reproductive health and rights, family planning, gender just kept popping up all over the place. We wanted to normalize in the minds of conservation and biodiversity practitioners that it's okay to talk about things more broadly than what's perceived to be normal biodiversity conservation. And these three documents are three IUCN policies, which are three of our biggest achievements of the last year or so. Now, I accept that these will not be policies that you know well. But the first one, the Global Species Action Plan, is perhaps the most important. Earlier, we've referred to the new targets that the Convention on Biological Diversity has. That's the Global Biodiversity Framework. You can see the subheading on the first document refers to the Global Biodiversity Framework. So this document, this many 100-page document, is the plan that IUCN has prepared over the process of 18 months with a vast amount of consultation with governments and biodiversity actors. And this sets out how IUCN thinks we all need to act as society to reach the targets in the Global Biodiversity Framework. And we had advocated for about a year of those 18 months that it was important to reflect the importance of reproductive choice. Carina referred to the resolution that we led at one of the previous IUCN World Conservation Congresses. The title of that is The Importance to the Conservation of Nature of Removing Barriers to Rights-Based and Voluntary Family Planning. Now, that language has now been incorporated by IUCN into their Global Species Action Plan. So when you are engaging with your Ministry of Environment about what your National Biodiversity Plan should state, you can now rely on the fact that IUCN, not just the Margaret Pyke Trust, has highlighted that to reach the targets of the Global Biodiversity Framework, it's important to remove barriers to family planning. But then there are two completely different plans that we're sharing here. Over time, we have been surprised by the openness of many biodiversity conservationists to engage with us. Biodiversity conservationists work often in rural areas and they do work with people. So I think sometimes there's this perception that they're only interested in nature and they're not interested in people. And we're finding that that's not true. So we were approached by people working on the Amphibian Conservation Action Plan. This was something which surprised us, as you could imagine. But this plan, which is the lead document for how all biodiversity conservation organizations and countries they've committed to focus on amphibian conservation, now expressly calls out, amongst many other cross-sectoral messages that we got in there, how important it was to link reproductive health, education, sustainable development, community organization, and habitat conservation. So this is actually the phraseology among multiple other useful entry points that amphibian conservationists have said is important for amphibian conservation. Now, if you were to look at your draft or your country's draft NBSAP, there is overwhelmingly likely to be a section on wetland conservation and the kinds of things that you need to do to conserve wetlands. Now there is a further entry point. The plan on the right-hand side of this slide is a plan that relates to 10 different species of monkey that live in sub-Saharan Africa. Now, we worked with the 10 groups of specialists on those primate species, and I think it's 6 of the 10 now highlights the critical importance to conserve those species on, and now quoting the plan, that they respond to the public health needs of the neighboring human populations. So some of that will be to do with zoonosis because diseases can pass between primates and non-human primates. But we've also got express references to reproductive choice, to family planning and gender in that plan. Now, this is important because the primate plan or the one that's on the right-hand side of this slide, it actually highlights in which countries are the various primates. So we assume that the governments that are where those species are have already reviewed this plan. So, for instance, Kenya, one of the species is in a very small area of Kenya. That the Kenyan Ministry of Environment has already accepted this, and therefore, hopefully, there could be an additional entry point when engaging the Kenyan Ministry of Environment on the NBSAP. But there's other entry points that you will know as well. So in this century, we are slowly becoming better at working or at least slightly considering other sectors, but we are still, of course, siloed. And when you hopefully might consider engaging your ministries of environment on this process, of course, they are more focused on SDG 13, on climate action, and SDG 14 and 15, which are the water and land related and environmental SDGs. But we've called out this target because in SDG 3, it does expressly say that we must ensure that universal access to sexual and reproductive health is included in national strategies and programs. This target doesn't say that it's essential that SRHR is in national health plans. It says that it's in national strategies. So actually, we would argue that when you're engaging your ministries of environment, actually the SDGs require them when looking at this particular type of national strategy to consider SRHR. That has been signed up to. So I'm not going to get into the more technical arguments. There's a couple of more technical arguments that we have suggested in this guidance. But something that's worth sharing, I think, is that biodiversity conservationists are also very data-driven, just like the health sector. You have more allies with them than perhaps you might expect. We've done a lot of work with an alliance of governments and conservation NGOs called the Conservation Measures Partnership. It's referred to in our guide. But in that, this group of conservation practitioners that suggests theories of change and ways of measuring impact that's best practice, they have accepted bringing in reproductive choice into their theories of change. We've worked with them to create a generic theory of change of when you integrate action on human and environmental health. We've created another generic theory of change that's specifically about reproductive health and environmental health, as well as then covering 3 specific population health environment programs, including our project in Uganda that Carina has referred to. But the reason I call this out is because whilst most of us on this call are not familiar with the Conservation Measures Partnership, the people that we hope you might engage in the Ministry of Health will be. We do have language and framing which is understandable to us, that supports our rights-based framework and supports SRHR, but is also the kind of lever that's understood by those working in the ministries of the environment. So just to leave you with a final thought, where we are on our most progressed country is we've been doing work with our partner in Madagascar. Their NBSAP review has launched. We had a very narrow opportunity to comment on their draft. But then when we looked at their draft, there wasn't, I'm just reading this out, they'd already referred to rural populations are experiencing strong demographic growth. So we noted that that is the line that's coming out of Madagascar before we've been involved. But of course, if we don't highlight that women playing a critical role in managing natural resources and promoting sustainable agriculture is not possible if they lack reproductive choice, no one's going to. But there is an entry point, and that there were other entry points as well. I think what I'm trying to say is that when you read your country's draft national plan, you would see just obvious entry points because of the overlaps. But if we don't engage with this process, nobody else will. And then sexual reproductive health and rights will just be forgotten because people are working in silos. So I'm going to draw a close there and just say thank you. But we're very much hoping that we are going to have some questions, and that after this call, we're obviously happy to talk to anyone else and work with you if you were keen to see if it was possible to work in your country. Thank you.
Awesome. Thank you so much, David and Carina. That was an incredibly helpful presentation with a lot of great ideas for how to better link some of our work with policy opportunities, as well as advocacy opportunities for climate. So we have about 15 minutes for some Q&A with David and Carina. And so to our members who are on the line, if you have any questions or anything that you want to learn more about, please feel free to raise your hand and you can come off mute and ask those directly. Or if you would prefer, you are welcome to put questions in the chat and I can refer those over to David and Carina as well. So we will give people a moment to think. Maybe one question that I had while people are thinking through some questions that they might have is just whether you have encountered any barriers to kind of exploring this work, to implementing some of this work. I know your presentation had a lot of the advocacy and policy wins, but wondering if there's ever been barriers that you've had to overcome and kind of how you've navigated that.
I think acronyms are a barrier. I was desperately trying to not. I mean, it's actually a serious point because working across sectors is harder than working on your own. We recently did a workshop in Mozambique with PSI and our partner Conserve Global, and it became a joke in the meeting that we were saying there are no stupid questions, and raise your hand the moment someone says an acronym that you don't understand, and it was every 30 seconds. And there are so many words that we, and if you talk about environmental impacts, you're probably talking about the negative impact of the development. We're talking about health impact as a positive thing. There's words like communities. If we talk about communities, we're probably talking about a marginalized community. It's probably some people that we would really like to give health services to. The Nature Conservancy once stopped us from using the word community because in biodiversity, a community is when there's 2 or more species living in the same area. So they make us say human communities. And it goes from really small things like that to much bigger things about how I think we should go into this with an open mind and not see the worst in the other sector, because everyone has their own concerns and anxieties. And I think the challenge is about reminding ourselves that sometimes we, if we want change and if we want the money from another sector for our work, we have to actually try and win that money and use arguments that work. So it's about being open-minded.
Awesome. Thanks, David. That's an excellent set of answers. Yeah, there's certainly a need for a common language as we work across sectors, and kind of making sure that we're proactively addressing that. And then even just, yeah, some of the framing of impact in communities is not something that I had thought of. So that's very helpful. Any other questions that people have? And again, feel free to raise your hands, feel free to come off of mute. Know that we also have several people on the line who have done some work around climate and SRHR as well. So if you have any reflections or reactions that you would add, you're most welcome to do that as well.
Can I jump in while people are
Please do, yeah.
Pondering and digesting everything we've just thrown at them? I want to come back to the question you posed and maybe answer it from a slightly different perspective and perhaps a global perspective. When you said, what are some of the challenges? I think the challenges and the barriers that we are really looking to address as we take this particular piece of work, but other programmatic work, building the alliance work. We always say there are 4 major areas that we are looking to influence, and 4 things that need to pretty much happen at once. One can't happen without the other. We need more implementing organizations who are coming on board to have this level of understanding and take up this kind of work. We need more donors supporting this type of work, but therefore we need more evidence to show donors that this work is worthwhile. And fourthly, we need funding streams or mechanisms that make these type of cross-sectoral efforts possible, whether it's cross-sectoral work the advocacy level, cross-sectoral work at the programmatic level. We need funding mechanisms that allow this type of cross-sectoral work to take place. Otherwise, having calls, we see these calls for gender transformative action, multi-sectoral action, we see those calls. But unless we are implementing those, gathering the evidence and working across sectors, then those calls are not being taken up, and that's to the detriment of the communities that we've spoken about. So yeah, we've identified those 4 main areas of challenges, and our work really looks to address those.
Awesome. Thanks, Carina. Yeah, that's an excellent point. I think some of the cross-sectoral funding can be tricky. So certainly want to highlight, and a need for evidence is also great. I got a question directly in the chat that I will ask. So this is kind of around the national action plans as a whole. And the question was, which countries have already adopted national action plans? would you say that there's a country that has the best one that incorporates SRHR? And then is there a deadline for adopting them?
Brilliant questions. So as far as we're aware, no one has updated them. So there's 196 countries which are parties to the Convention on Biological Diversity. I think, from memory, 194 of them have passed an NBSAP. But the critically important thing is that you have to keep updating them. So the time limited opportunity now is because there are new targets, everyone has to update them. So in the old NBSAPs, it's very weak. There are exceptionally limited. There's not going to be any references to SRHR because no SRHR advocates would even have been engaging in the process back then. So the language that does exist in a handful of them is not quite how we would want it to be. There might be references to gender-based violence coming from biodiversity loss or climate change. That's probably about all you've got. But like, we've just not been present. So the important thing now is that kind of forget the existing plans. This is now the time that they're all being updated, and we've got more entry points than ever before. And critically, the new Global Biodiversity Framework actually expressly calls out gender. It expressly calls out interlinkages between human and environmental health. So we've actually got a chance of getting more words in there. Oh, and on deadlines, I think technically there is a deadline, but the reality is, being frank, lots of people don't have funding to actually do it. So it's not like there is, they should all be published by various dates. It's not going to happen. The start point really is engaging at your country's level and finding out where is your country in the process.
Awesome. Thank you so much, David. Any other questions? Yeah, Sono, go ahead.
So first of all, thank you for introducing us to Margaret Pyke Trust's work in this grouping. I think it's really great to have this connection. And I was going to say that Margaret Pyke Trust also has a lot of great experience, as well as a guide they put out several years ago on how to engage in climate change spaces for SRHR organizations. So I think a lot of that report is still valid, and we're testing all of those recommendations as we speak. So we're refining our advocacy strategies from that. But yeah, it might be another good chance to introduce the climate sort of subgroup of RHSC to think about that publication and go through that. And then to say that I've been at UNGA this week, listening to various people talk about climate and health, and they do think it's a breakthrough that climate and health finally came together at COP28 last year. So this is really an opportunity that everybody is hopeful for, to insert, gender and SRHR as well as other concerns. And people are happy that the SDGs are really coming alive, in the sense that people are thinking more cross-sectorally, and there isn't like this huge insurmountable barrier of people wanting to work cross-sectorally or not. So thanks.
Awesome. Thank you, Sono. Yeah, thank you for highlighting that resource as well. And for those who are following along in the chat, you'll see that David just put a link to that in the chat. Thank you, Sono. Any other questions, reflections, thoughts from our members who are on the line?
As we wait for the final reflection from someone to come in, then I shall share some news which we haven't actually shared before. So our landmark project in Uganda that's been developed to have livelihoods, biodiversity work, and health work more broadly, but including family planning, has been developed in a way so we could test our hypothesis of, do you get better outcomes by working together? And we've just had a manuscript accepted from the British Medical Journal, where actually the academics are going to share some of the benefits of this approach. But unfortunately, one thing that hasn't got into that paper, because the data has come out since it was written, is that we've just found out that working cross-sectorally like this has had a disproportionate benefit impact in terms of reproductive health service provision on survivors of gender-based violence, but actually a staggering increase in take-up of services. And it's all to do with trust and so much more besides that we don't have time to go in today. But I suppose what I'm trying to get across there is this is like a universally positive thing, because by working across sectors, you just get so many more entry points. You know, all of the obvious stuff about men aren't interested in reproductive health, but they are livelihoods, and so much more beyond that. So I really think there's like an opportunity at the moment for the early adopters, the SRHR organizations and the conservation organizations that get with this, because it's a universally positive thing to do.
Yeah, thanks, David. I'm so glad you said that. That's you know, the concept of collective action and multi-sectoral collaboration and trust really underpins all that RHSC is focused on. So I think it's a really great point that it's not, you know, it's not just about coming together to kind of create that impact or overcome certain barriers, but that it's really a catalyst in moving things forward. So thank you for sharing that. That's excellent. And we'll look forward to seeing the publication when it's out. I think with time, we're in our final 2 minutes. So I'll invite Amos and B if you have any kind of closing thoughts on the Advocacy and Accountability Working Group side. And then we'll invite Carina and David for any just final remarks or calls to action that they might have for us. So Amos and B, over to you.
I'm not sure if Amos is on, but I just want to thank you both, Carina and David, for this very informative presentation. And I want to say that for a lot of what we've discussed, I think there will be opportunities to reach out to you to talk a little bit more in detail about how our different partners in different country contexts might be able to use the same sort of approach, a holistic and integrated approach to addressing some of these issues that you highlighted. I just want to give a few minutes for Amos, just in case his connection is back up. I don't see it.
No, I think he's still off B.
Okay.
Network challenges.
Okay. And so I guess on behalf of the AAWG, behalf of our partners here at RHSC, we thank you very much. And we hope that we will have the opportunity to continue to work together. I'm pretty sure that our colleagues are going to reach out to you because it's such an important intersectional issue. Thank you.
Awesome. Thank you so much, B.
Over to you, Carina and David, for any last words.
I should let Carina have the last word. I've spoken too much.
Not at all. Thank you so much. Thanks, David. And thank you again, Reproductive Health Supplies Coalition colleagues, for having us. I think we've been keen to speak to you and to have this opportunity to use your amazing platform. Great that two of the working groups were on here today to listen to us. As we said, this was one specific piece of work that's really tangible and that everyone can really dive into, get on board with, and use their own country contexts to address these issues in an intersectional way. But and as Sono brought up, you know, we have done a lot on reproductive choice and climate adaptation and resilience as well, and we're continuing to do that. So if anyone wants to reach out about that specifically as well, we'd be really happy to continue the conversation. We are looking to host an event. We are going to be hosting an event at the World Health Summit on these issues, specifically focusing on donors and getting more investment unlocked at the intersection of climate and health. So please look out for that. I'll be happy to share that event invitation with the group. And we just hope to continue the conversation with you. I will stop there. Thank you so much.
Awesome. Thank you so much. And thank you, David and Carina, for sharing your time and your expertise with us today. We will, for everybody on the line, we will circulate the meeting recording to the full listserv, and we'll also put this one up on the RHSC webinar hub, since I know there's a lot of interest in this topic. So we thank you both, and we will be in touch for future collaboration. I hope everyone has a great rest of the day. Thanks, everybody.
Thank you.
Bye.